Nose burning, causes and home remedies. A burning feeling in the nose can stem from an infection, allergic reaction, or another cause of irritation. A person may also experience burning, irritation, or itching in the eyes, throat, or sinuses. In this video, we explore the causes of a burning sensation in the nose along with their treatments and other symptoms. We also look into home remedies that can reduce irritation. Causes. A burning sensation in the nose may result from inflammation or irritation brought about by an infection or allergic reaction. Allergic rhinitis. Rhinitis refers to inflammation inside the nose. In a person with allergic rhinitis, the immune system mistakenly interprets a harmless substance such as dust or pollen as a threat and attacks it, leading to the inflammation. Allergic rhinitis is very common, affecting 10 to 30% of people worldwide. When the allergen responsible is pollen or something else that presents seasonally, the doctor may diagnose seasonal allergic rhinitis, which is better known as hay fever. The symptoms of hay fever can include itchiness or a burning sensation in the nose, mouth, throat, and eyes, a stuffy nose, headaches, a running nose and eyes, dark circles around the eyes, sneezing, postnasal drip, which can cause frequent throat clearing. The quickest way to relieve allergic rhinitis symptoms is to avoid the allergen. For example, people with pollen allergies may limit their time outdoors during days with high pollen counts. Over-the-counter antihistamines and nasal corticosteroids can also help ease the symptoms. Another option is allergy immunotherapy, which involves exposing the person to tiny doses of allergen, teaching their immune system not to react to it. For the person, this may involve placing a tablet under the tongue each day or receiving irregular injections. Non-allergic rhinitis. Around 1 in 3 rhinitis cases are not caused by an allergic reaction. In this case, the condition is called non-allergic rhinitis. It tends to affect adults and cause symptoms all year, including sneezing, a runny nose, a stuffy nose, postnasal drip, a burning sensation in the nose. Unlike allergic rhinitis, this issue usually does not cause itchiness or symptoms that affect the eyes or throat. A person with non-allergic rhinitis may have a sensitivity to air pollution, certain odors or chemicals, or changes in the weather. Some medications and health issues such as viral infections can cause inflammation in the nose. Avoiding triggers may help ease the symptoms of non-allergic rhinitis. While there is no cure, saline nasal sprays and medicated sprays or rinses may help reduce the inflammation. Sinusitis. Sinusitis is an infection of the sinuses. The sinuses are small, empty spaces behind the cheeks and forehead. Sinusitis can occur due to a viral or bacterial infection. Symptoms of sinusitis include a runny or stuffy nose, pain in the cheeks and forehead, headaches, a sore throat, mucus dripping down the throat, a cough, a fever. Most cases of sinusitis result from viral infections, which tend to go away on their own without treatment. When the cause is bacterial, a doctor can prescribe antibiotics. Cold viruses. Around 1 billion colds occur in the United States each year, most of which result from rhinovirus infections. The symptoms may include a sore throat, a runny or stuffy nose, which can cause a burning sensation, a cough, headaches, body aches, a loss of taste and smell, a fever. Usually cold symptoms go away without treatment, though certain medications and home remedies can ease symptoms. For example, decongestant medications can help unblock a stuffy nose. Influenza. Influenza or the flu is another common respiratory tract infection. The flu can cause mild to severe symptoms that include fatigue, headaches, body aches, a cough, a sore throat, a fever, a runny or stuffy nose, sometimes with a burning sensation. Some people also experience vomiting and diarrhea. The symptoms of the flu often develop suddenly. Most people recover without medical treatment, but certain groups have a higher risk and may require extra care and precautions, including adults older than 65, pregnant women, children under 5 years of age, people with chronic health conditions. Other respiratory infections. An infection can develop in any part of the respiratory tract, including the nose, throat, and lungs. Coronaviruses such as SARS-CoV-2 are sometimes responsible. SARS-CoV-2 is a virus that causes COVID-19. Some symptoms of COVID-19 may include a fever, a cough, shortness of breath, tiredness, headaches and body aches, a loss of taste or smell, a sore throat, a runny or stuffy nose, which may lead to a burning sensation, nausea or vomiting, diarrhea. Is it a sign of a stroke? A burning sensation in the nose is not an indication of a stroke. The symptoms of a stroke include sudden numbness in the face, legs or arms, especially on one side of the body, problems seeing in one or both eyes, difficulty walking, a loss of balance or coordination, a severe headache, trouble speaking or understanding speech. Home remedies. Home remedies cannot cure an infection or allergic reaction, but they can ease the symptoms and relieve discomfort. For a viral illness such as a cold or the flu, a person can inhale steam from a hot bath or a bowl of very hot water to clear congestion. Drink plenty of fluids to replace any lost due to vomiting or diarrhea. Get plenty of rest. For ongoing nasal irritation or inflammation, a person can try saline nasal sprays or rinses. Also, increasing the amount of moisture in the air with a humidifier may make breathing easier and reduce discomfort. When to see a doctor. Anyone who develops sudden or severe symptoms should receive medical care. If a doctor determines that a burning sensation in the nose results from a bacterial infection, they will prescribe antibiotics. A doctor can also perform allergy testing before diagnosing allergic rhinitis. However, if a person may have COVID-19, they should call ahead to check whether it is safe to visit the clinic, office or hospital. If a doctor believes that someone may have COVID-19, they will advise about the next steps.